FDA has become a much more global agency over the last couple of years. What are the trends driving this expanded role?
The main trend is that we live in a globalized world, and the products that we, the FDA, as a regulatory authority responsible for promoting and protecting the health of the American people, really have to look outside our borders because we're getting products from all over the world. You know, huge percentages of the food that you eat and the drugs that you take are actually coming either in part or in whole from other countries and are following pretty complex supply chains which introduce vulnerabilities. So we need to be working on a global stage.
How has that changed FDA's approach? You've been FDA commissioner for the last couple of years. How have you adapted?
Well, it is requiring, some new thinking and some new ways of doing business, and it's involved some changes internally so that we start to integrate our domestic work and our international work and really see the international work as part and parcel of our core mission rather than sort of a nice diplomatic function that we do outside of our other business. Global engagement has to be business as usual every day at the FDA from now going forward.
How do you build partnerships with emerging countries like China and India to ensure that the flow of goods is safe and secure?
Mm-hmm. Well, we've been doing it in a number of different ways. One is to really start to build the personal and professional relationships, then to start to institutionalize them a little bit more, including we now do have foreign offices. In China, we actually have 3 in Beijing, Shanghai, and Guangzhou. In India, another important partner, we have 2 in Mumbai and in New Delhi. And we have other offices in other parts of the world. So having that physical presence enables us to work on a day-to-day basis with regulators in those countries and also with the industries and other stakeholders, including the scientists, because at the end of the day, science is the foundation of all that we do. And we're really trying to move towards a much more formal new system of global governance, a way that lots of regulatory authorities, the sophisticated, mature regulatory authorities like the US FDA and the much more skeletal and developing regulatory authorities, that we can all work together to sort of share information and start to develop some common approaches and ways of doing business together.
Bringing it back home for a second, this all requires resources. We're in a tough fiscal environment now. How are you working with Congress to ensure that FDA has the resources that you really need?
Well, it's an ongoing challenge, but it's so important. And a lot of it has to do with really helping people to understand what FDA is as an agency of government and why we're so unique and important. The truth is that FDA really does serve this critical, I think often underappreciated role that has sort of cascading levels of influence and impact. And one really has to be very careful about making sure that even in difficult economic times, FDA remains sufficiently intact and robust that we can do our job and do it well, because it matters to people and their families and their communities, because we're regulating products that people are using every day and counting on, whether it's the drugs they take or the food they eat or the microwave that they use. But we are regulating products that account for almost 25 cents of every dollar that consumers spend on products. So we matter in people's lives. We matter in terms of the health of the healthcare system, in terms of ability to assure safe and quality products that really work, and hopefully that can help even bring down costs. And we matter enormously to the health of the economy as well, because we're regulating some of the most important industries in our country. And if we can do it in a smart way that benefits industry because it increases trust and confidence in their products and the quality of their products, everybody benefits. So we're a pretty little agency with a pretty big impact.
As you think about these top-line priorities, what are yours for the next administration or for the coming Congress?
Well, I have 3 main priorities that I've really focused on during my tenure as commissioner and will continue to do so. One is really building the support for FDA, the understanding of what we do, then building out the science, because that really matters. And we're in an era where the advances in science and technology are just enormous, and we have a real responsibility to make sure that, number one, those advances in science and technology really translate into benefits for people. And then the third priority is really responding to the challenges of globalization, which are growing enormously. The products that we regulate that are coming from countries outside of our own have quadrupled in the last decade, and I expect those trends to continue. Puts huge demands on us, but in order to fulfill our mission, we need to respond, and respond aggressively, and respond with new models for how to achieve our critical goals. And importantly, that means thinking both in new ways and building new partnerships to get the job done.
Thank you, Dr. Hamburg. We really appreciate you being here with us.
Thank you.